So look at the concept of remote patient monitoring. Remote patient monitoring. So remote patient monitoring just how to do it. I mustn't be where my patient is, okay, for me to be able to monitor them. All right, we have social medias, we have all those video calls and stuff. I can always follow up my patient using all those tools. So for remote patient monitoring, you just have to do it. It's a healthcare approach, so it uses digital technology to be able to track the patient's health data, okay, outside the traditional method that the patient must come to me. So you often do it as they are from their homes, okay. So it's a cornerstone of modern value-based care, all right, especially for managing chronic conditions, okay, that maybe the cure is not all of it is not fast. So you can still do these ways to monitor your patients, okay. So patients use FDA approved devices, okay. So the patient is basically trying to help you work better. So like, let me say for blood pressure, they are monitoring their blood pressure by themselves. The body temperature, they are doing it by themselves. Their pulse, they are doing it by themselves, and they are giving you the values. So the values is helping you to know how the patient is recovering. So data can be transmitted through Bluetooth, cellular network, or Wi-Fi to a secure cloud platform. Providers can access this data through clinical dashboards, often enhanced by AI algorithms, okay. And the AI algorithms can just help you even identify if there's any abnormality. Okay, so remote patient monitoring platforms may include patient portals or mobile apps. Right? Maybe you guys are using a mobile app developed by the hospital, or the patient came to you. You guys opened a portal for the patient on your hospital. So the patient is putting these data directly on the dashboard for you to see, or once the patient used that instrument or device that you gave the patient, the device can automatically send the information to the portal. Do you understand? There are many ways they do this. So benefits is there's continuous monitoring. You are not waiting till the patient come to you before you can be able to track their health. All right. Early intervention. If there's any complications, you can early on intervene. Okay. Reduce hospital readmission. Improve patient engagement, equitable access, support value-based care. Okay. So who benefits the most in remote patient monitoring? You see, patients with chronic diseases like diabetes, hepatitis, chronic obstructive pulmonary disease, heart failure. These diseases, they stay with the patient for a long time. You can't be saying the patient should be coming to the hospital every time. Also, individuals recovering from surgery or hospitalization, elderly patient needing full dictation of medication reminders. You can be following up your patient and be reminding, have you taken this drug? Have you taken all this drug? Pregnant women, then people with limited mobility or limited access to care.